I want to bring in Congressman Bera. He's a physician, and he also represents California's 7th District, where a confirmed case is being treated. Congressman, I have to ask you, you're a physician. You have a district that is being impacted by this virus. Do you have faith that the government, under the leadership of the Trump administration, has a handle on this virus?
Yeah, I think President Trump was slow to get ahead of this. You know, we've been asking for witnesses and others to come up to Congress and testify and inform the public for a while. They finally did last week, but that was a little bit late. You know, in fact, you know, getting things up and running. He's got good people working for him, Dr. Tony Fauci, Dr. Redfield at the CDC and others, but let them do their job and let's not politicize this.
Do you believe that they are able to do their job under the current guidelines?
You know, I think the president is starting to realize that we've got a crisis potentially here in America, so he's letting them speak a little bit more freely. But that was slow in coming. You know, that my sense, my opinion, is that he put a muzzle on him.
Congressman, what would you need to have this administration do or say to make you feel as though they are doing everything in their power to contain this virus?
You know, I think the president needs to step out of the way. He needs to let the scientists and the doctors and his public health officials take the lead here and be there in a supportive way, be there in a reassuring way. It's hard, though, because the president's got a credibility problem.
When you talk to other medical professionals in your district, what are they telling you about the state of preparedness when it comes to treating those who are already infected?
You know, the risk to the general public still is relatively low. That said, you know, we are going to see additional community-acquired cases. You're seeing them in Oregon and Washington State. We've had a second one here in California. And we just have to make sure we get funding and resources to those public health departments, to the hospitals, to the folks that are on the front line. You know, that is something that the administration was late in asking for. We pushed them to ask for it, you know, 5-6 weeks ago. Let's get those resources to the front lines just in case.
Yeah, Congressman, that brings me to my next question, which is what is the role of Congress in a moment like this?
You know, Congress clearly has a role in appropriating supplemental funding, getting extra resources there. The administration asked for $2.5 billion. We don't think that's nearly enough. You know, fortunately, the president said he'd take what we give him, and I think it'll be in the $6 to $8 billion range. And that may even not be enough to get supplies to make sure the public health workers have the resources that they need. That's the best thing we can do right now.
Congressman, moments like this have an odd way of bringing public health into focus, right? I ride the subway with other people. I walk down the street with other people. I send my child to school with other people. What are the questions we need to be asking ourselves about the way that we as a country approach public health and access to affordable health care?
You know, what we have to do is we have to make sure everyone has the ability, if they get sick, to go see a doctor, and if they get really sick, not to worry about going bankrupt. So they feel like they can approach their healthcare professionals. We also do have to build in better public health measures, you know, vaccinations, just basic health programs, teaching kids basic hygiene. You know, the best thing we can do right now is just, you know, wash our hands, practice good hygiene, et cetera. If you're sick, stay home. If you feel like you're really sick, you know, go see that doctor. But if you don't have health insurance, a lot of people don't get the health care that they need, and that's a problem.
Congressman, I appreciate your calm. And so I wonder, what is the line between preparedness, alertness on these questions, and then total and utter freak out?
You know, right now, preparedness is the right thing to do. This is where you want to see congressional leadership, presidential leadership, reassuring the public not to panic, but just to be vigilant, to take those steps that are necessary. Right now, the risk to the general public is relatively low, but if you have a chronic condition, if you have pulmonary disease, et cetera, you might want to take some extra precautions. But again, right now, let's just be vigilant, but the risk to the general public is pretty low.
All right, Congressman Bera, thank you so much for your time.